Dear students, welcome back. In the previous session, we have seen the mobility and stability of elbow complex. In this session, we are going to see the effects of age, gender, injury, and immobilization. So, like other joints in the body, the joints and muscles of the elbow complex may be subject to the effects of age, injury, and immobilization. When come to age and gender, as the age increases, there is a decrease in muscle strength, and it is all which depends upon the type of muscle action involved, whether it is eccentric or concentric, and also the muscle group involved. Okay, so as the age increases, there is a decrease in muscle strength, which depends upon the type of muscle action involved, whether it is eccentric or concentric, and the muscle group involved. And coming to the gender, so in this gender, in males and females, there may be some variations of strength which depends upon the level of physical activity. Okay, when you see in the case of elder people and the younger people, these elder people have been found that they have smaller pennation angles and decreased physical length. Because of this loss of this decreased physical length and the small pennation angles, which accounts as much as 50% of the loss of muscle function. Fortunately, resistance training may be able to increase physical length and therefore the number of sarcomeres. Although in elderly people, there is a decrease in pennation angles and decreased physical length, but it can be increased due to resistance training. Okay, and in the case of younger subjects, they produce significantly greater relative joint torques than the older people across all effort levels except for the light effort level. Okay, and now some of the studies done by Waller and Pawson found that maximal isometric force and series elastic component complaints of the elbow flexors were significantly less in the elderly than in younger peoples. But the antagonistic co-activation was similar for both the groups. Okay, so these are some of the variations seen in age and gender. So if you see in gender, we'll take some two examples or two studies done by some biomechanists. So they have done studies in 68 women and 52 men. The isokinetic strength in the elbow flexors and extensors are declined by 2% per decade for women, whereas 12% per decade for men. This is for isokinetic strength. When come to the muscle quality, that is peak torque per unit of muscle mass, the muscle quality for concentric peak torque showed that a 28% decrease in men and 20% decrease in women. This is for concentric peak torque. Whereas in the case of eccentric peak torque showed that there is 25% decline in men, but the decline is not that much significant in women. Okay. In the case of active elbow flexion and extension, the peak torque power and angle of peak torque production measured bilaterally and showed highly significant differences between young and old. Okay, however, no age-related differences occurred in supination and pronation. In the case of isokinetic elbow flexor and extensor peak torque was less in men at the age of 60 to 83 years than in men 20 to 59 years. Maximal isometric force production also declined at the age of 60 years. So this is about the variation seen in age and gender. When you come to the muscular effort in young and old, there are some studies done by John determined that old people, that is in the age between 65 to 70 years, require significantly greater muscular effort than do younger subjects at the age of 20 to 40 years during isometric elbow flexion and extension torque production tasks. Okay, and because the elderly also made more severe errors in judgment about the amount of effort needed to accomplish a motor torque. If the person has to do some motor torque, it should be a perfect judgment which has come from the CNS, isn't it? That disturbances are also seen in old people. Okay, and in the case of younger subjects, were able to produce significantly larger torques for both flexion and extension tasks than the older subjects at all effort levels except for the lowest effort level. And some other studies that Klein and associate found that the area of type 1 fibers in the biceps brachii muscle and maximum voluntary strength of the elbow flexors is lower in elderly than in young persons. But the percentages of type 2 fibers and type 1 fiber areas are not different between young and old persons. Okay. So whatever, if you can see, in the case of young and old, the muscle capacity, that means the muscle strength is going to decrease according to the age. But there are some, and also it depends upon the level of physical activity. So whatever physical activity they have taken in all variations of physical activity, the muscle strength is going to decreased in old people except in lowest effort level. Okay, so this is about this effects of age and gender. Now we will move on to the injury. So injuries. So these injuries are of various types, and the injuries to the elbow are fairly common, and in early adolescence the elbow is one of the most common sites for strains. Okay, now to understand the mechanisms of elbow injuries and their relation to the elbow joint structures is necessary for determining the effects of injuries on joint functions. Now, the first type of injury is the compression injury. In this compression type of injuries, resistance to longitudinal compression forces. So this is called as longitudinal compression force. Resistance to longitudinal compression forces at the elbow is mainly provided by the contact of bony components. Okay, So therefore excessive compression forces at the elbow often result in bony failure. So this is very important. So resistance to longitudinal compression forces at the elbow is provided mainly by the contact of bony components. Therefore, any excessive compression forces at the elbow often result in bony failure. Okay. Falling on the hand when the elbow is in closed back position. So this one is the closed back position, that is extended position, may result in transmission of forces through the bones of the forearm to the elbow. So if the forces are transmitted through the radius, as may happen with concomitant valgus stress. So this is the way. So and also it is having some valgus stress which causes fracture in the radial head, Okay, and this may result from the impact of radial head on the capitulum. And a fracture of the radial head may be accompanied by a tear of the central band of the interosseous membrane also, which normally provides the majority of the membrane's strength. Okay, but this central band has little physiological ability to heal. Okay, so this is one type of compression injury where the excessive compression forces are traveled through the radius. Okay, when you come to the ulna, if the force from fall is transmitted to the ulna, a fracture of either the coronoid process, so there may be the coronoid process of the ulna or olecranian process may occur from the impact of the ulna on the humerus. If neither the radius nor ulna absorbs the excessive force by fracturing, then the force may be transmitted to the humerus. So if the compression forces are absorbed by this radius and ulna, then what will happen? The fractures are taking place in radius and ulna. If these forces are not absorbed by these bones and these forces are transmitted to the humerus, and which causes the fracture of the humerus mainly at the supracondylar area. Okay, this is about the compression injury. Coming to the distraction injuries. In the case of distraction injuries, normally the resistance of the joints of the elbow complex to longitudinal traction is provided by the ligaments and muscles. Okay, that means the ligaments and muscles provide for resistance of the joints of the elbow complex to longitudinal traction. Okay, a tensile force of sufficient magnitude exerted on a pronated and extended forearm may cause the radius to be pulled out from the annular ligament. So what is the position? What is that force? Tensile force of sufficient magnitude exerted on a pronated and extended forearm causes the radius to be pulled inferiorly out of the annular ligament. This injury is common in children younger than 5 years and rare in adults. For example, lifting a small child up into the air by one or both hands or anchoring a child by one hand is the usual causative mechanism, and therefore this kind of injury is referred as nursemaid's elbow. What do you call? This is called as nursemaid's elbow. This is about the compression injuries and the distraction injuries. After that, we are going to see the varus and valgus injuries. Dear students, before we will move on to valgus and varus injuries, there is another important compression injuries which are caused by the muscle contractions. Okay, here in this we can see the muscle contractions also may cause high compression forces at the elbow. For example, during the acceleration and deceleration phases of baseball pitching, and the compression forces of the elbow can attain 90% of body weight, and nerve compression, bony fracture or dislocation may also result from muscle contractions. So here we can see in this pic, there is a repetitive forceful contractions of this flexor carpi ulnaris muscle may compress the ulnar nerve as it passes through the cubital tunnel. So this cubital tunnel normally present between the medial epicondyle of the humerus and olecranian process of the ulna. So this is a fibrous sheath actually, which connects the posterior side of the medial epicondyle to the olecranian process, forming a tunnel for the passage of ulnar nerve. Okay. So if you want to refer this cubital tunnel, you can see in anatomy videos. Okay, according to Chen and colleagues, the ulnar nerve may be subjected not only to compression but also to traction and friction stresses during flexion and extension. These stresses can cause an injury called cubital tunnel syndrome, in which motion of the fourth and fifth fingers is impaired. So this is one kind of compression injuries due to the high level of muscular contractions, okay, which can attain 90% of the body weight. Okay, now we will see the varus and valgus injuries. So distraction and compression forces are created if either one of the collateral ligaments is overstretched or turned. For example, here and this one is the valgus stress and this one is the varus stress. So if one side of the joint is subjected to the abnormal tensile stress, the other side is subjected to the abnormal compressive forces. So because this valgus stress means here the tensile stress is more on the medial side, so this kind of stress is called as valgus stress, which create an abnormal compressive stress on the other side. Okay, if you see in the varus stress, so there is an abnormal tensile stress is created on the lateral side, whereas abnormal compressive stress is occurred at the medial side of the joint. For example, if you see there is the medial collateral ligament is going to subject to tensile stress during the backswing or cock-up portion of the throwing a ball. If the stress on the medial collateral ligament is repetitive, such as in baseball pitching, the ligament may become lax and unable to reinforce the medial aspect of the joint. The resulting medial instability may cause an increase in the normal carrying angle and causes excessive compression. So that means there may be elongation at the medial side, which causes excessive compression on the lateral side aspect of the joint, so that the radial head impacts on the capitulum. If abnormal compressive forces on the articular cartilage are prolonged, these forces may interfere with the blood supply of the cartilage on the lateral side, and result in avascular necrosis of the capitulum. Okay, and this is about medial collateral ligament which undergoes tensile stresses. So some other conditions that may occur in throwing, elbow includes ulnar neuritis, flexor pronator muscle strain or tendinitis, and medial epicondylitis. Okay, the medial tendinitis and medial epicondylitis may be caused by forceful repetitive contractions of pronator teres and the flexor carpi radialis and occasionally the flexor carpi ulnaris. So all these muscles commonly originating at the medial epicondyle. Okay, so these muscles are involved in the tensor. That means in the tensor, when there is a combined motion of elbow extension, pronation and wrist flexion is used. Okay, so and this medial epicondylitis is also called as golfer's elbow. Here we are going to see some of the conditions called as tennis elbow and the golfer's elbow in detail. Okay, yes, we'll move on to this tennis elbow. In the case of tennis elbow, normally it is called as lateral epicondylitis. This is not only seen in tennis but also in other way of sports which involve such kind of muscle groups like racquetball, paddle tennis, squash, etc. And the use of a racket greatly increases the length of the forearm lever and subjects the elbow complex structures to great stress. Okay. So this classic tennis elbow is caused by a repeated forceful contractions of the wrist extensors, primarily the extensor carpi radialis brevis muscle. The tensile stress created at the origin of the extensor carpi radialis brevis may cause microscopic tears that lead to inflammation of the lateral epicondyle. And this repeated tensile stress on the inelastic tendon may result in microscopic tears at the musculo-tendinous junction and result in tendinitis also. Okay, this medial tendinitis or medial epicondylitis may be caused by forceful repetitive contractions of pronator teres, flexor carpi radialis and occasionally by the flexor carpi ulnaris. Normally these muscles are involved in tennis serve when the combined motion of elbow extension, pronation and wrist flexion is employed. Okay, so such kind of thing is seen in tennis elbow, mainly the lateral epicondylitis. It is also called as lateral epicondylitis, and the main muscle involved here is the extensor carpi radialis brevis. Okay, now we'll see the golfer's elbow. In the case of golfer's elbow, it is called as medial epicondylitis, caused by the repeated movement of the palm toward the forearm, applying a strain on the wrist flexors, causing pain. Okay, it is mainly caused by the repeated movement of the palm toward the forearm, applying a strain on the wrist flexors, causing pain. That means in the case of golfer's elbow, the flexor compartment of the forearm are going to be affected. Okay. Whereas in the case of tennis elbow, the extensors are involving. So it is causing inflammation at the lateral epicondylitis. Whereas in the case of golfer's elbow, it is causing inflammation at the medial epicondyle. So that means if the flexors are overused, it causes inflammation. This is not only confined to golfers, it is common among people overusing their arm, doing different activities such as painting, racking, typing, turning doorknobs, picking something up with the palm down, even shaking hands during opening of jars cause opening jars. These are some common type of activities which causes the inflammation of the medial epicondyle. So all these activities, what I have mentioned earlier, are involving the flexor group of muscles. Okay, and the main cause is due to a throw of direct injury, or a direct injury on the medial epicondyle. And also there may be some partial tears of the muscles. Okay, these are some of the causes regarding golfer's elbow. So in the case of tennis elbow, when it is called as tennis elbow and golfer's elbow means, so both in the case of tennis elbow, whereas in the golfer's elbow, the main thing affected is the elbow complex, isn't it? That is, in tennis elbow, there is an inflammation in the lateral epicondylis, whereas in the golfer's elbow, in the case of medial epicondylitis. That means overall, the conditions may be different because of the area of injury. In the case of, if you can see in the tennis serve, it also includes the wrist extension, isn't it? Sorry, not wrist extension, elbow extension, and also pronation and also wrist flexion. That means both the extensors as well as the pronators as well as this flexors are involving. So which finally leads to either tennis elbow or golfer's elbow in the case of tennis players. Okay, so this is all about the effects of age, gender, injury, and also the immobilization. Okay, so in the case of immobilization, the joints and the muscles of elbow complex are subjected to the immobilization. This immobilization of the elbow in 90 degrees of flexion has been found to result in significant decrease in flexor strength, but not significant decrease in extensor strength. This decrease in flexor strength could potentially disrupt normal joint function because the relative strength of the flexor versus the extensors shows that the flexors are stronger than the extensors. If the flexors become weaker than the extensors, the flexors might not be able to contract the pull of extensors and the joint might hyperextended during extension. Okay. So also the flexor muscle contributions to the joint compression would be decreased and therefore joint stability would be diminished. Okay, so this is about the effects of immobilization. Okay, this is all about the elbow complex. Thank you.